Dr. Leisle, when a mom with a child comes into your office, maybe the first time or, maybe second, third time, whatever. Anyway, the mom comes in with the child. How do you handle the fact of should mom stand next to the child and hold the child's hand and be there, make it feel comfortable? Would you rather prefer that you take the child more like alone, so the child becomes, more self-confident, used, whatever it is? How do you handle this situation?
Thank you for asking. That's a very good question, especially on first-time parents coming in the office, first-time parent with one child at home. When a child comes in the office, we like to make the first visit. First of all, before the child even comes in, the parent makes it like it's no big deal. I mean, and it isn't. It's fun to make it like we're going to the zoo, we're going to the market. It's just a matter-of-fact place we're going. And when they come in, I like to have the parents back into we have an open bay. What's behind me here, open bay of 5 chairs. And when the parent comes in, they come in with the child. They get their x-ray. Sometimes they have to help the child, especially if they're under 3, since 55% of my practice is 3 and under. 2-year-old doesn't necessarily want to sit still, like for getting their hair cut or getting their teeth looked at or x-rayed. Sometimes the parent has to be involved in that process. And if they're not pregnant, then we can have that done. But anyway, so when we're doing the examination, I like the parent to be next to the child, so the parent is informed what's going on, and the child feels confident. A child has more confidence depending on their age level. It's always a good thing to have the parent there. So I like the parent looking in the mouth with me and seeing what's going on, but not being overly doting on the child. In other words, not talking to well, it's okay, he's not going to hurt you, and using some what we would think would be encouraging terms, but when we use certain words like it's not going to hurt or it's not going to be painful, all this, it's like when we're kids, Helmut, if I said, draw a line in the ground and says, don't cross that line, what are you going to do? We're going to cross that line. And when you tell a child it's not going to hurt, they're going to go just the opposite. Okay? So I like to have the parent there.
If the salesperson says, trust me, we know to start running, right?
Yeah. Or he says, and truthfully, that's what they've been saying before then. Anyway, I don't want to get off topic here, but
right.
But when a parent is in there, the less that they're saying, the better. Because when the dentist is looking through the child's mouth, I'm talking with them. I'm singing or counting the teeth. 1, 2, 3, 4, 5, 6, 7. And the child's looking at me. I mean, obviously I'm not doing that with an 8-year-old, but with a 2-year-old or a 3-year-old or a 4-year-old, I'm counting teeth. I'm talking with them about this or that, and I'm building rapport. I'm establishing a relationship. And if a parent is interjecting comments or statements, there's going to be a challenge because the child is all of a sudden confused. Who am I listening to? And most parents, they understand that they want so much for it to be a good experience. Sometimes they're going to interject too much. But for the parent that sits back and listens, then I'll go about halfway through the mouth. I say, Mom or Dad, did you have any questions you want to ask me about little Susie's mouth, little Johnny's mouth? And they'll ask you a question or two. Sometimes they're so into what's going on, they forget the question they really want to ask me. And when I'm all done, they say, oh, I forgot to ask.
Right.
So the more matter of fact it is, the more fun it is, the more the parent is relaxed, not tense. Because when the parent starts getting these worried looks in their face or these frowning looks, the child picks up on that. Children read into, that's why I'm smiling when I'm looking at that child's mouth. This is easy, it's fun. Let's have some fun here. And that's why we really turn around some children that have had some negative experiences in other offices. But it's good.
It's all good. Wonderful. So basically, yes, the parents can and should be there, but should turn over their hat to the dentist, and he is in communication with the child, which at that moment is the patient. So basically the doctor, you start talking to the child of like, hey, how do you like that? What do you think about that? Does it bother you?
Yeah.
What about this? What about that? Do children say something about your hole in there? Whatever it may be that you ask. But
so after the child gets his x-rays, or he or she get the x-rays done, then they're sitting over there, they're watching TV, they're coloring some picture, or whatever, they're playing a game, and then I come over, and the first thing I do, I don't look in their mouth. The first thing I do, hi Mom, I introduce myself to the child, and usually I go to the child first. Because, like you said, they're the one I'm establishing rapport with. And it's not to make the parents second best, but it's to make sure the child understands they are the most important person there. And I get down on their level. Then I have them come out of the chair. We look at the x-rays. I'm sitting in a chair. They're standing next to me looking at the x-rays that are eye level for them. And the parent is behind them. And I'm talking to the child most of the time. 80%, 90% of the time I'm talking with the child. And so I'm establishing that rapport with them and asking pertinent questions to the parent as we're looking at the x-rays. And then as I'm looking at the child back in the chair, and that's when I look in the mouth. So I've done several things with the child before I even open their mouth and look at what's going on. If it's a child over 6 years of age, parents standing there, and I do an oral exam, an oral cancer exam, where I'm checking their lymphadenopathy, their lymph nodes in their neck, looking at their tongue, and then I look at their teeth. So I'm not bringing out the mirror and the Explorer until after I've done all this stuff, because that Explorer can be intimidating to a child. They see this sharp object, they're kind of, what's going on? I just say, here's my counter, here's my mirror, here's my counter, here's my flashlight, my overhead light. I don't call it here's my dental light. It's my flashlight for your mouth. And these are terms the child can understand, And he says, well, what do you do with that pointy thing? Well, I count your teeth. It's a matter of fact. And then I build trust, and they open their mouth. I shoot my mouth open, they open their mouth, and we go through. And it's easy. It's an easy experience. So
most of the time, children are just fine with it anyway.
Yeah. Beautiful. It's us adults sometimes. We put things on our kids, right? We inflect things, we reflect things to them. So that's why I always say, oh, Mom, gee, you're making me nervous. You're making that frowny face at me. Or Dad, I go, oh, yeah. Oh, okay. And then it becomes a positive experience.
Right. Well, obviously, with no doubt, and most of us adults know it, but we may reactively not act on it. You see, 40 years ago, dentistry was more painful. You know what I mean? The drills were big, the injections were big. They were like scary. They're like a pipe, like a half-inch pipe. Sure. In order to find out whether a tooth was hurting, the dentist would pull around his little, mirror and bang each tooth. And so even if the tooth didn't hurt, it surely hurt just the banging on it. So we parents have that thing still somehow in it, even though if we really observe, it doesn't happen anymore. But it's ingrained, and so it's too easy to calm the kid about nothing, and just the calming alone worries the kid. Kind of, why is Mom so trying to calm me down here? Whoa, what's going on? Well, all right.
Yeah.
Good. Children are fine and in good hands. It looks like the most important part is to show them and teach them and get them used to take proper care of dentistry as a kid, so it becomes normal.
Yeah, exactly. A whole new generation of positive influence.
Yeah. Thousands of dollars saved down the road, and never mind.
And emotional stress.
Emotional stress.
And which you can't put a number to. Yeah.
And physical illness saved. Well,
self-image. Mm-hmm.
Yes. Always very interesting talking to you. Bye, Dr. Leisle.
You have a good afternoon.